ওকে, হ্যাঁ আমি গেলাম, ঠিক আছে, আল্লাহ হাফিজ।
হ্যাঁ,
আচ্ছা
যান,
ঠিক আছে।
তাতে তাতে চলে এসেন। হ্যাঁ, ওকে। সাবি আপু,
হ্যাঁ জি ভাইয়া।
হ্যাঁ শুরু করেন তাহলে। হ্যাঁ,
আচ্ছা ভাই, আমি কি ডক্টর?
হ্যাঁ ডক্টর হন।
আচ্ছা। Hello, this is Dr. Safia Zebin, one of the doctor of the gastroenterology at the clinic. Before the proceeding, I'd like to confirm, am I the talking the Mrs. Stone, the 70 years old?
Yes, doctor, I am Mrs. Stone.
Hello, Mrs. Stone. Nice to meet you.
Nice to meet you too, doctor.
Okay. Mrs. Stone, before discussing our the condition of the today, I would like to ask, do you need anyone else to attend our meeting today?
No, doctor, you can talk everything about me.
Okay. So, Mrs. Stone, how can I help you?
Uh, Doctor, actually, I have come here with some problems. Actually, I have lost some weights in the last couple of months, and I have pain in my upper abdomen after eating, and I feel sometimes very full easily after eating. Uh,
Okay. Okay.
do you think it really I should worry about?
Well, how can I help you? Say that. I will sort these things out for you. So, Mrs. Stone, I'd like to proceed
Yes, doctor.
regarding the condition. So I'll talk to you. Along with that, I'll examine you. Is it okay for you?
Yes, doctor. It's okay.
Okay. Mrs. Stone, you already told me you have the weight loss. Along with that, you have the tummy, the pain. So I'd like to ask the how much do you lose your weight, and how long? For how long?
Doctor, in the last couple of months, I think I have lost about 2 stones of weight. And actually, I felt sick few times, and I feel very tired in the last couple of months also.
Okay, I'm so sorry to hear about that. So you're the weight loss along with you told me you have the tummy pain also. So can I ask, did you ever experience the throwing up?
I have experienced throwing up for about 2 times in the last week.
Okay, okay. So this is when did it happen? After the taking the food or before that?
Yes,
Any
doctor.
relation with
Hi.
food?
Yes, doctor. I haven't noticed it already, but I can remember all the episodes are occurred after my after 1 hour after my eating has stopped.
Okay. So what's the come up with your throwing up?
It's the what I have eaten. It's all come out.
Is fresh the food or some
Yes,
unfresh?
it's just no, it's just fresh foods that I have taken, and I have come up all this.
Okay. So did you notice any sort of the blood or blood strength, any color the change?
No, doctor.
Okay. It's just the food, the particle. What have you eaten?
Yes, doctor.
Okay. So I'd like to ask some more of the question. What about your back patches?
It's okay. I haven't feel any irregularities in the last couple of months.
Sorry, I didn't get that. Any irregularities or everything is
No,
okay?
doctor. Everything is okay. I don't feel any irregularities in my back
Okay,
passages.
you don't have okay. You don't have the problem with the bowel the motion. So okay.
No, doctor.
So uh, so here the tummy pain. Is tummy pain is can you tell me there are any aggravating the factor? Anything say the increasing here the tummy pain?
Yes, doctor. When I have eaten all my foods after a half hour, the pain starts.
Okay. So can I ask you some more the question regarding your the medical the condition? Should I be the concern of any medical condition?
Yes, doctor. Last 2 to 3 years, I have been diagnosed by my GP as one of my gland abnormality. GP called it is something like
Mhm.
hypothyroidism, and he prescribed some medications for it, and I'm taking it regularly.
Okay. So you're taking your medicine regularly? There is any over the counter the medicine, or did you stop the medicine in somehow in some point?
Yes, doctor. I have taken sometimes paracetamol for my back pain and antacid tablets. I think this can ease my abdominal discomfort, but it helps very little.
Okay, so do you have to take the antacid frequently?
No, doctor. I just take very irregularly. It's not just regular medications to me.
Okay, so do you have any already you told me you're the taking drugs for the hypothyroidism?
Hello,
Did you when did you hello
hello,
hello
hello.
শোনা যাচ্ছে? হ্যালো, হ্যাঁ ভাইয়া আমি শুনতে পাচ্ছি। হ্যালো, শোনা যাচ্ছে না ভাইয়া? হ্যালো। হুম।
Hello.
হ্যাঁ জি ভাইয়া।
Hello, doctor. Are you with me?
Yes. Okay. So already you told me you're taking thyroid medicine for your hypothyroidism. When did you last check your the thyroid test?
Uh, it's I think about 1 month. The GP checked all my gland status and he told it was okay.
Okay, that's good. So you already told me your bowel motion is the normal. Still, I would like to ask, there is any the color change in your the stool? Did you notice?
No, doctor. I don't
Okay. So
find any abnormality in my color of my stool.
okay. So surrounding your people, your relatives or your dear one, they ever the ask you ever would notice your being the pallor day by day.
No, doctor.
Okay, that's good. So I like to the ask, what do you do for your living?
Actually, a driver.
Okay, so nowadays, if you're on the work or you're being the retired.
No, doctor. I am on work now.
Okay, okay, that's nice. So, do you have any sure of the operation or the surgery in your the past?
No, doctor.
You already told me you are taking some antacid or the paracetamol or the thyroxine, the drugs, the medicine for your the condition. May I know your family the member how their health, your
Actually,
parents?
I have lost my father's around 20 years ago. I can
Mhm.
remember my father had an ulcer. He took lots of tablets, but always suffered with his indigestion like problems.
Okay, okay, okay. I got it. I'm so sorry to know about that. And about your the mother.
No, I think she was okay till his last breath.
So okay. So what about your the siblings? They are all in good health.
Yes, doctor, they are in good health.
In your the family member, I'm so sorry to ask about that. You don't need to get tense more. Do you have any family member have the cancer or relatives have the cancer history ever?
No, doctor.
Okay, that's really good. So to whom you're living,
I live with my partner.
the partner. So do you need anyone to take care of yourself, or you're independent?
No, doctor, I'm independent and my partner is also. We
Okay,
can look after
so
ourselves and I don't need take to help from each other.
okay, okay, sounds it sounds good. So I'd like to ask some of the personal question, if you don't mind.
Sure, doctor.
So, do you smoke?
Yes, doctor, it's occasionally. It's a very little actually.
How stick? You already told me the occasionally, but
No,
how many this
one to two stick per week actually it is.
per week? So, I'd like to advise you, Mrs. John. Any sort of the even of the one of the stick of the smoking is really the unhealthy for your health. So, I'd
Yes,
like to refer
doctor.
you our
I
smoking
know that.
suggestion of
I
the
know
clinic.
that. Oh, no, it will be great help for me.
Okay, thank you so much. So I'll refer you our smoking suggestion or the clinic. They will help you out. Okay. So do you drink alcohol, Mrs. Stone,
Actually, it's mm, 2 to 3 times usually per week.
within social limit?
Within social limit, actually, it is.
Okay, okay, got it. So Mrs. Stone, if you the permit, I would like to examine you.
Yes, doctor. Please.
If you feel any sort of discomfort or any sort of the pain, you can just stop me uh, as soon as possible. It will be all right.
Okay,
Okay.
doctor.
So I like to see that the patient that has the anemia or the jaundice, and also there is any lymphadenopathy, and especially supraclavicular area, and then will come to the abdomen. In the abdomen, any mass or any the lymphadenopathy or organo or the megaly the present or the not. Um, that's all. And may I know, Mrs. Stone, what are the concern, particular the concern?
Doctor, I'm a little bit of tensed about my situation. Do I have an ulcer or something like that? I'm talking because my father had an ulcer also.
Okay. Yes, I got it. I appreciate the concern. Mrs. Stone, yes, it could be. It could be it is an ulcer, as you're giving the history of there's a tummy, the pain, the also the some the weight loss. Also your appetite not so good at it before, but it could be the ulcer, it could be some other the cause. So before the concluding the condition, we need to do the blood test, also some the camera the test, and after that we'll be the sure that what actually will happen to you.
Doctor, you
If
have
you're the
told
friend,
other doctor, you have told other causes. What are the other causes? And could it be a very serious thing?
Mrs. Stone, I'm really sorry to say that yes, there is some more the possible the cause as at your the age, and also you have appetite loss, weight loss, and tummy the pain. It could be not so good condition, like it could be some bad growth in your food pipe or the stomach also. It could be the cancer. Don't get worried. It's the one of the possible the cause. There is a lots of the cause.
Doctor,
Here we
what
have
you told? I just lost some weights and some vomiting, and this can be cancer.
Mrs. Stone, we are not sure right now. And to be sure, we have to do blood work or also the camera the test. We are not the saying that yes, this is the cancer, but it could be the one of the possible the cause. And if
Okay,
it
okay,
could
doctor, I can
also the
understand.
outer.
But what is camera test?
And camera the test is just the simple the narrow the tube with the like pen like the size of the tube, and will the attach some the camera on the tube, and it will the insert it through the mouth to see your food pipe, also the stomach, to see the more the visualization about what actually the happen in the stomach of the food pipe. It could be visualized by camera the test.
Doctor, could it hurt?
Actually, not so. It's not going to be more of the hurt as our the expert hand. They will do this at the camera the test, as this is the team. They did this at the camera test many as the before. There is you will go through the some sedation or the spray that will the numb your the throat the area, so it's not going to be too the painful. Are
Okay,
you
okay,
following me,
doctor.
Mrs. Stone?
Yes, yes, doctor. I'm very much worried about it now. Doctor, what is the most possible worst outcome of this test? You were telling it is little bit of uncomfortable. Really, it is, or something more worse can be caused by this test.
Mrs. Stone, I'm really highly appreciated your the concern. I know you're very worried about what is the camera, the test. And Mrs. Stone, I'd like to assure you that it's not going to be too the painful, as we'll give you the sedation or the spray. There is a not so much the complication with this the camera the test, but most the common complication that yes, some kind of the throat of the pain you will the experience after just a short after the camera the test, and very rare. I'm repeating that very rarely it can be the bleeding, or sometimes there is an injury by the tube to the stomach and food pipe the happening that called the perforation. But I repeating this sentence again, is very rarely, as
Oh my
our
God,
very
doctor,
expert
it can cause bleeding and even perforation. That I
is
have to
very
need
rare.
operation. Things are really getting hard for me, doctor.
Is very rare. It's very rare the complication, and we can reassure you it's not going to be happened. It's very rare complication, and we'll give you some the website address, also some of the brochures about the endoscopy, the procedure, and you can read it down at the home. And if have any inquiry about that, you can ask our endoscopist also if you have any inquiry.
Doctor, should I need to take any preparation for this camera test?
We'll provide you some of the leaflet, and for here all the preparation and what should be the taken before the end camera the test. all the things
Uh,
are written.
doc-
You'll be instructed.
Okay, doctor, how many days I have to wait to going through this test?
As you have the weight loss or also some of the appetite of the loss, and will they arrange as much as the early as possible, and well, maybe the 2 day or maybe the day after the 2 day, but will they try to arrange as early as possible.
Oh, okay, doctor. I'm very glad that you have given me so much importance. I really
I
appreciate that.
I really highly appreciate that you will agree with us. So after doing the camera, the test, and other the blood of the work, and will refer to you our the gastric, the bowel, the doctor, stomach, the doctor. So the further management, the plan, and the future, you have the end of the inquiry, our bowel, the doctor, they will for you.
Doctor, what if this test comes some kind of cancer? Then what will happen to me?
Um, Actually, Mrs. Toad, after if you God forbidden, if you see that yes, there is some the cancer that you have there, then after that we'll do some of the more the test to detect what the stage are you in, and after the staging, you're the condition, you're the cancer the level, and our oncologist doctor, our cancer doctor, our bowel the doctor, and also the operation of the cancer the doctor, they will decide what will be the management of the plan.
Okay, doctor. So
So
you are talking, I have to go through this camera test very recently to evaluate me appropriately. Okay,
yes.
that is just assuring me a little bit. Okay, doctor.
Okay, Mrs. Stone, do you have any more of the concern or any more of the inquiry?
No, doctor, I don't have.
So, Mrs.
Uh,
Stone, do you need anyone to drive you to home?
Thank you, doctor. Though this is a very just like a shock to me, but I can drive to go back me at home.
This sounds really good. So, Mrs. Stone, I'd like to conclude our the meeting today. Have a nice day, Mrs. Stone.
Okay, doctor. Thank you very much.
আচ্ছা।
আপনার খুব ভালো হয়েছে, খুবই চমৎকার হয়েছে। আসলে মানে কি বলবো, আর 2 বছর আগে পরীক্ষা দিতে বুঝতে পারতেছি।
আরে না ভাইয়া। আচ্ছা।
আমাদের ভাই গেল কই, সৌরভ ভাই? তো
আচ্ছা
আচ্ছা, এখানে
ভাইয়া,
তাহলে হ্যাঁ
এখন হচ্ছে যে এক্সামিনার হচ্ছে তাহলে আস্ক হচ্ছে করবে যে তোমার ডায়াগনোসিস হচ্ছে কি, তাই না?
হ্যাঁ
হোয়াটস ইউর দ্য ডায়াগনোসিস। তো হচ্ছে গ্যাস্ট্রিক হচ্ছে ডিডি আসবে আর কি।
আচ্ছা আচ্ছা
as
এখানে
হচ্ছে
এখানে কয়েকটা করি, মানে কি কি জিনিস মিস হয়েছে আমার মতে আর কি।
হুম হুম
আমার কাছে মনে হচ্ছে আপনার আহ আচ্ছা, ওই যে স্মোকিং হিস্ট্রি,
হুম
মানে মানে স্মোকিং রিলেটেড কমপ্লিকেশন, সাপোজ এখানে তো একটু ডিডি আসতে পারে, মনে করেন যে লাং ক্যান্সার, তো
হুম হুম
ব্রেথলেসনেস, তারপরে হিমোপ্টাইসিস,
হুম
এই ধরনের এগুলা এগুলা
হুম
সম্ভবত পয়েন্টার টাচ করার দরকার ছিল। তারপরে
হুম
আপনার অকুপেশনাল হিস্ট্রি, তো হ্যাঁ নিছেন
হুম হুম
ড্রাইভার, ঠিক আছে। আচ্ছা, তাহলে আরেকটা কজ হইতে পারে হচ্ছে আপনার হাইপারথাইরয়েডিজম।
হুম
হাইপারথাইরয়েডিজম
হুম
যদিও 1 মাস আগে আমরা বলছি রিপোর্ট ঠিক আছে, তবুও হিট
হুম
ইনটলারেন্স আছে কিনা, ট্রেমর আছে কিনা, এই।
হুম হুম
আচ্ছা, এটা একটা জিনিস মনে হয়। আরেকটা হচ্ছে আপনার কোনো জন্ডিসের হিস্ট্রি আছে কিনা।
হুম 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 হুম
জন্ডিসের মানে ওই যে লিভার ক্যান্সার বা সামথিং ক্যান্সার তো হতে পারে, যে কোনো ক্যান্সার,
প্যানক্রিয়াটিক ক্যান্সার।
প্যানক্রিয়াটিক ক্যান্সার, হ্যাঁ এই ধরনের ক্যান্সার হতে পারে কিনা, স্কিনে স্ক্লেরা, ইউরিনে ইয়েলো ডিসকালারেশন অথবা ইচিং আছে কিনা, এই। এছাড়া সবকিছু খুবই ভালো হয়েছে, এক্সিলেন্ট।
হ্যাঁ ভাইয়া, ওটা অ্যাকচুয়ালি ভাইয়া ওয়েট লস তো হচ্ছে আমাদের সবকিছুই আসবে না, একদম আহ পা থেকে মাথা পর্যন্ত হচ্ছে যা যা ওয়েট লস এর কারণ
হ্যাঁ
গুলা
হ্যাঁ হ্যাঁ
হচ্ছে আসবে।
হ্যাঁ, মানে সিএ স্টমাক আসবে, সিএ এসোফেগাস আসবে, সিএ লাং আসবে, সিএ কোলন আসবে, তারপর হচ্ছে
হ্যাঁ
আপনার আইবিডি, সিএ প্যানক্রিয়াস, মানে সবই আসবে অ্যাকচুয়ালি ওয়েট লসের মধ্যে।
হ্যাঁ,
70
সবই হচ্ছে
বছর, হ্যাঁ 70 বছর বয়স্ক ভদ্র মহিলা মোটামুটি সবই আনতে হবে, এই আর কি। আমাদের আসলে অ্যাকচুয়ালি টাইম কতটুকু থাকবে এখানে? 20 মিনিট
ভাইয়া এখানে
Yes.
হ্যাঁ 20 মিনিট মনে হয় ভাইয়া, টাইম গুলো না আমি ভুলে যাচ্ছি। আর ভাইয়া ওই যে স্টেশন 4 কিন্তু ভাইয়া আর 10 মিনিট টাইম, নট হচ্ছে 20 মিনিট।
হ্যাঁ মানে স্টেশন 4 মানে হচ্ছে কি মানে ওই যে কমিউনিকেশন স্টেশন।
হ্যাঁ কাউন্সিলিং এর স্টেশনটা যেটা, ওইটা দুইটা দুইটা থাকবে কেস, কিন্তু 10 মিনিট। আর ডক্টরের এক্সামিনারের সাথে কোনো ক্রস হচ্ছে এক্সামিনেশন চেকিং হচ্ছে না, কোনো কোশ্চেন আপনাকে জিজ্ঞেস করবে না।
মানে কোশ্চেন গুলো ওই সার্ভার করাবে এই আর কি।
মানে হ্যাঁ আপনারা শুধু কনভারসেশন করে স্যারোগেটের সাথে বা পেশেন্টের সাথে করে চলে আসবেন, এখানে আর এক্সামিনার জাস্ট অবজারভার হিসেবে থাকবে।
ওটা হচ্ছে 10 মিনিট।
10 মিনিট, 10 মিনিট দুইটা দুইটা, তাহলে 20 মিনিট।
মানে এই যে চেঞ্জ করলো না নিয়ম কানুন গুলা, খুবই কমপ্লিকেটেড হয়ে গেছে। আমি আমি টোটালি মনে রাখতে পারতেছি না কোনটা কোন স্টেশন, কোনটাতে
হ্যাঁ
কত
হ্যাঁ
মিনিট।
হ্যাঁ, আমিও মনে রাখতে পারতেছি না। শুধু এতটুকু মনে আছে স্টেশন 4টা আর হচ্ছে 5টা
হুম।
ভাইয়া একটু হচ্ছে সময়টা বাড়াইছে, এতটুকু মনে আছে শুধু।
মানে আমরা যেটা এখন সলভ করতেছি এটা এখন 20 মিনিট হয়েছে।
হ্যাঁ মোস্ট প্রবাবলি সময় বাড়াচ্ছে, কত মিনিট আমি এক্সাক্ট বলতে পারতেছি না, কিন্তু সময় বাড়ানো হয়েছে।
20 মিনিট আপা, কারণ সবগুলো 20 মিনিটের ম্যাক্সিমাম, এর বেশিরভাগ সময় নেই।
20 মিনিটে।
হ্যাঁ 5 মিনিট ইন্টার স্টেশন গ্যাপ, আর হচ্ছে 20 মিনিট হচ্ছে আপনার স্টেশন।
হুম
সেটা যদি দুই ভাগে ভাগ হয় তাহলে 10 মিনিট 10 মিনিট।
হুম ঠিক আছে।
এই আর কি। উম, আচ্ছা।
আচ্ছা
আমি
ভাইয়া
কি,
কি আসবে বলছে?
হ্যাঁ তো বললো তো আসবে। আমি কি একবার ডক্টর হবো এখানে?
হ্যাঁ হ্যাঁ হন ভাইয়া। হুম। হ্যালো।
হ্যাঁ আমি শুনতেছি। আচ্ছা ঠিক আছে তাহলে বিসমিল্লাহ। Hello, this is Dr. Tanvir from Gastroenterology Department. May I confirm I'm talking to Mrs. Stones, 70 years old.
Yes.
Hello, Mr. Stones. Thank you for being here in this meeting with me. How are you now?
So good. I have lots of the problem is going on.
Okay, Mr. Stones. Actually, today we are here to discuss your health condition. Do you prefer anyone to attend this meeting?
No, I'm okay.
Okay, then proceeding further, I would like to know how much do you know about your condition, and actually what's your expectation from this meeting?
Mm, Actually, doctor, I'm experiencing some the weight loss. It's about now the month. That's all. That's all, and I like to know that what actually happened with me. And before that,
Oh,
I convinced myself because of I'm not taking the food. I'm not able to taking the food properly. That's why I think I'm losing my weight. But it's now the getting out of hands. I'm really worried about that.
okay, it's very sorry to hear that you have lost some weight in the last couple of months, and you are unable to take foods regularly. What's the problem of you with you taking your foods?
But the problem is I'm not feeling the well. I'm not. I don't want to take any food. I don't have any appetite. That is the main problem.
Do you feel any pain during you swallowing of your food?
Not really.
Okay, ma'am, can you just tell me how much weight you have lost in the last couple of
It's
months?
about like more than 8 kg, and
Oh,
within the 2 months.
it's a significant amount of loss, weight you have lost. Actually, ma'am, may I know, do you have any burning at your tummy or kind of bitter taste in your mouth?
Yes, there is some bitter tasting in the mouth, and I feel not burning, but there is some pain around my tummy.
Okay, ma'am, have you ever experiencing sticking of food at your throat?
No,
Okay. Uh, mm, what's about your bowel habit actually?
bowel habit is perfectly all right.
Have you seen any kind of bleeding through your back passage?
Bleeding, no.
Okay, ma'am. Ma'am, do you smoke actually?
Yes,
Actually, how much? How many sticks per day you have smoked?
it's about 2 or 3 the stick.
Okay. Have you ever experienced throwing of food particles
Yes, last week.
last week? How many times?
It's about two times in one day.
Yeah. Have you experienced? Have you seen any blood in this throwing out?
No, actually, no blood. I have the scene. But why did you ask me about my back pressures, the bleeding or not? About my the throwing it up is containing the blood. Is it serious something?
No, ma'am. You have presented with weight loss and abdominal pain that can be caused by many possibilities. We have to rule out all these to give you best of us.
Okay, okay. Keep going.
Okay, ma'am. Thank you for being with me. Ma'am, what are you doing actually as your profession?
I'm retired. I was the banker, but right now I'm retired.
Okay. Do you have any other previous problems that should be in our consideration?
Not really, but I have the some hormone the problem around my throat. That is some gland problem, and that's why I'm taking some medicine, and I'm okay with that.
Ma'am, can you remember what GP told you about this gland problem?
Uh, they called I have the problem in my thyroid, and they give me some thyroxine, levothyroxine medicine.
Okay. When the last time you have checked your hormone level?
And the last month, I have just checked last month. It's okay. It's perfectly
This one,
okay.
okay. Okay, ma'am. Very glad to hear that. Ma'am, do you have any preference for cold or hot environment?
Actually, I had it before the taking this medication, but right now I'm perfectly all right.
And I'm sure that you don't have any kind of tremor right now, tremor of your hand or tremor any part of the body.
Okay, what is tremor?
It's kind of oscillatory movement, some kind of to and fro movement of your hand or finger.
Some shaking. Are you talking about
Some
there's a shaking
shakiness.
movement?
Yes, hand. It's actually
Oh,
shakiness.
no,
Okay. Do you have ever any kind of history of yellow discoloration of your skin, your eye, or your urine? Or you
no,
ever experience any kind of severe itching of your body?
no.
Okay,
I
ma'am.
have
Very
eating. I have the eating before when I just the diagnosis with my gland problem, but right now I don't have this kind of the
okay,
problem.
madam. Very good to hear that. Madam, do you take any kind of medications as regular basis?
Not really, no. Apart from levothyroxine, no other medication.
It's not some kind of painkiller or something?
Sometimes, very occasionally, kind of the tramadol I'm taking for my low back pain, but very
No, back
occasionally.
pain. Okay, it's tremor. Ma'am, do you have undergo any kind of previous operations before?
No,
Okay, very good to hear that. Madam, just personal question. Do you take alcohol?
yes,
How much it is?
it's about 1 or 2 pack at
Two
weekend.
bags. Okay, it's just in the weekend, just in a social tolerable limit, I think it is.
Yes.
Okay, very glad to hear that. Ma'am, do you have any family issue of same kind of problems?
Uh, my father, he was some of the kind of this kind of the problem he suffered when he is alive, when he was alive.
Okay, madam, very sad to hear that. Uh, how is he now? Is he okay?
Uh, I already told you that he was where when he was alive. He was a
Okay,
passed the way.
it's a password. Okay, I'm very sorry to hear that. Okay, ma'am, I want to examine you if it is okay, and I'm ensured that I will not hurt you. If you become hurt from my any procedure, just let me know, and then I take care of it. I'll stop it and stop it.
Okay, go
And
on,
then,
go on.
Okay, ma'am. Thank you for your kind cooperation. I will examine as a part of general examination for anemia, jaundice, cyanosis, tremor, uh, any kind of lymphadenopathy, especially cervical, supraclavicular, uh, and, paraortic, abdominal, any kind of mass in the abdomen, any kind of signs of liver disease, and at last I would ask examiner to perform a digital rectal examination to see any blood, to see any fresh blood in the digitum. Okay, madam. I have completed my examination, and thanks for allowing me and being here with me. Ma'am, do you have any kind of concerns?
Actually, I really wanted to know what's going on me. Already you told me many the time, several the time that I have throw out any blood or not. I'm really worried about now. This is the one kind of the cancer.
No, ma'am, I highly appreciate your concerns. Actually, um, summarizing it is a cancer or something like that. We need to arrange some tests to find out the cause of your stomach pain and weight loss. Actually, we'll arrange some blood test and chest X-ray today, and we'll arrange some camera test of your tummy as soon as possible. We have get an appointment for you in our gastroenterology department called this department deals with actually this kind of issues.
So, tell me just clearly, is it cancer?
Ma'am, is you are presenting with weight loss and abdominal pain. This can ranging from some simple ulcer to even some cancers. We already
Wow.
told that we have to do some test, and you have to go some test to rule out all of these, and so that we can give you a proper diagnosis
Oh my
about it.
God. Now I'm become all right. What are you telling at me? So what are the tests should I go through?
Ma'am, we have to arrange some kind of blood test and chest X-ray of your chest, and one camera test that is designed that is applied to see your tummy to observe any kind of issues that we have to deal about immediately.
So this is the camera test. So should I get admitted into the hospital?
No, ma'am. This can be done at outpatient basis actually. Ma'am, may I explain further about this test to you? That can ease your concerns
Okay,
about it.
okay. Go
Ma'am,
on.
it's actually camera test. It is done by very very thin pipe, just like a pen. That was a camera attached to it in front of it. It will be introduced through your mouth to your stomach to see, to
Mhm.
visualize actually what is happening there, what is causing the symptoms. If anything happens, we can take these samples from the to take it out and examine it more thoroughly. Ma'am, can you with me?
My God, it is too complicated for me. First of all, you told me it can be the cancer. I just came for just the 2 months the history of the weight loss. Now you're telling me that something is the tube will the inside it through my mouth. Why did you just do the CT scan of my tummy? You can rule out what actually happened to me.
No, ma'am, I'm very sorry that I have make you very worried about it, but I can assure you that this is not as critical as you think. We can hope that everything may be fine. It can be just an ulcer. Just we are doing this test to rule out all the possibilities, then so that any issues can be dealt very easily. We can arrange any prompt steps to manage your any of your conditions,
Okay,
and we
I
are
got it. But
trying
why
to.
did you? But what's wrong with some CT scan? Many of my relatives they do the CT scan to see the what the happen with their the tummy, their the other the liver. Can't you do just do the CT scan?
Ma'am, I really appreciate your concerns, and I highly appreciate your knowledge about these procedures. Hello,
Yes,
hello, are you with me, Doctor?
yes.
Okay. Okay, CT scan is actually in our mind, but not it is not in the first lines, because CT scan also have some limitations to diagnose what we are thinking you are presenting with, and it's not actually appropriate for all kind of issues that we have to deal about.
So you're telling me that the condition is my stomach, my food pipe is not going to be the seen in the CT scan. So that's why.
Actually, some conditions that we have to see them visually.
Oh, then go on. What can I say the more? Go on.
Hello, hello, this is
Yes,
Stone. Are you
yes,
with me?
yes. I'm there. Okay, go on. Just arrange all the camera, the test, or the blood test you need to
Okay,
do. I'm there.
okay, ma'am. Okay, ma'am. We are getting you. We're trying to get your getting your appointment as soon as possible. We are contacting also with our gastroenterology team. They will contact you as soon as possible and give you a good idea about what is this procedure and what is the preparations you have to take to go under this procedure, and what are the complications can you face about this procedure.
Okay.
Ma'am, do you have any other concerns about this?
No, I don't want to. I have the lots of the question, but I'm really pissed off right now. Just to give me the website link or whatever you leaflet and
Oh,
arrange the camera the test.
okay,
I'm
madam.
there.
I'm very sorry about that. I'm very sorry about that. I'm giving you some brochures, leaflets, and some kind of website link to know about complaints about this procedure. Ma'am, do you want someone to drive you home?
No, I'm all alone and I don't need anyone.
Oh, okay, ma'am. I hope you have understood what we have gone over with today to bit about your disease and about our plans. If anything hasn't made sense, we can discuss it further.
No, thank you. But you
Okay, ma'am.
already told me there is some of the complication of the camera, the test. So could you please tell
I
me?
I really appreciate your concerns, ma'am. Actually, this test is not too much painful. It can cause some complications, such as some kind of soreness of your mouth or throat. You have some difficulty in degradation for for a few days only, and it can rarely, but very rarely, can cause some kind of bleeding or even perforations of your gullet. And I'm telling this is a very rare incidents that we have faced.
Oh my God. So you're telling me so I can have also the bleeding or some the kind of the injury to by the food the pipe of the stomach because of
Ma'am,
this.
I am assuring you, our team is very much expertise in this kind of procedure, and we are doing it very often. Very often, we are doing this procedure is a large amount today, and this kind of incidence is very rare. Just keep in mind that every procedure we are going through, it's medical or something, can have a complication, and we have to uh, take it normal actually. And I'm assuring that we are taking every possible steps to avoid this kind of incidents to be happened.
Okay.
Okay, ma'am. Do you have any other concerns?
No, thank you.
Okay, ma'am. Thank you very much. Thank you very much to be here with me.
Okay.
থ্যাংক ইউ দুজনকেই। খুব ভালো হয়েছে ভাইয়া আপনার এইটা লাস্টে আমি যেটা শুনলাম আর কি।
তো ভাই আসছেন আপনি না, আমাদের ক্যাপ্টেন শেষ করতে আসছেন।
হ্যাঁ, ফ্লুয়েন্সি ভালো ছিল।
আচ্ছা, এখন কোথায় কোথায় সমস্যা ছিল আপা বলেন।
ভাইয়া আপনারটা সুন্দর হয়েছে যেগুলো আমি মিস করছি সেগুলো আপনি আবার যেমন যে প্র্যাঙ্কেটিকের ব্যাপারটা ধরতে পারছেন। আচ্ছা, আর ভাইয়া যেটা আমিও মিস করছি আর আপনি যে ডিসপেপসিয়া যে হার্ট বার্ন আর মানে এই গ্যাস্ট্রিক প্রবলেম গুলো আরেকটু হচ্ছে ভালোভাবে টাস্ক করার
হ্যাঁ
হচ্ছে
হ্যাঁ
দরকার হতেছিল, এটা আমিও মিস করছি আর কি। আর আরেকটা
আচ্ছা
যেটা হচ্ছে ভাইয়া, যে আমি যে বললাম যে সিটি স্ক্যান হচ্ছে করতে চাই, ইয়ে করবো না, এন্ডোস্কোপি করবো না,
হুম
ওই হ্যাঁ আপনার এটা হচ্ছে there is some of the limitation to see the properly about the food part। তো হ্যাঁ
হুম
এটাই হবে অ্যান্সারটা, মানে হচ্ছে কি অ্যান্সারটা হচ্ছে হবে যে we can see the properly the food
হ্যাঁ
pipe
হ্যাঁ
or stomach the lining which we
হ্যাঁ
can
হ্যাঁ
be
হ্যাঁ
seen at
ভিজুয়ালাইজড, হ্যাঁ
any other the procedure like the CT scan or
এটা তো
the
আন্দাজে বলছি, ঠিক আছে মনে হয় না?
না এটা ঠিক হয়েছে। আর সাথে হচ্ছে আরেকটা বলবেন যেটা, যে ইফ ইউ
হ্যাঁ
টেক এনি স্ন্যাপ, মানে আমরা যদি বায়োপসি যদি নিতে চাই এখান থেকে
হ্যাঁ
স্পেসিমেন, সেটা তো আমরা সিটি স্ক্যানে পারবো না, এটা
হ্যাঁ
হচ্ছে
হ্যাঁ হ্যাঁ
আমাদের ওই ফুড পাইপ মানে ক্যামেরা টেস্ট করে নিতে হবে।
আচ্ছা আচ্ছা
এটাই।
আচ্ছা হ্যাঁ
হ্যাঁ
ঠিক আছে
হয়েছে এটা।
আচ্ছা ঠিক আছে
Good, ভালো ভালো হয়েছে। আচ্ছা ওকে। আর আছে নাকি জিআইটি?
যেটি আর আর একটা আছে না কি জানি, সিগনিফিকেন্ট ব্লিডিং বা সামথিং, এটা কিছু একটা।
আছে, এই যে এটা নেক্সট কালকে আর কি আমরা তাহলে এটাই ধরবো, গ্যাস্ট্রোইন্টেস্টাইনাল ব্লিডিং সিগনিফিকেন্ট ব্লিড, এটা আর এটা হচ্ছে ওই কাউন্সিলিং থেকে যেটা আছে ওই টপিকটা আর কি থাকবে।
স্টেরয়েড থেরাপি, কাউন্সেলিং ফর স্টেরয়েড থেরাপি সাইড ইফেক্ট।
স্টেরয়েড থেরাপি
হ্যাঁ
দেখতেছি।
কালকে তো এটাই মনে হয়। তাহলে এই যে সিগনিফিকেন্ট ব্লিড, স্টেরয়েড থেরাপি সাইড ইফেক্ট। সৌরভ ভাই আপনি তাহলে এটা করেন, কমিউনিকেশনটা করেন, ওই যে আফটার পিসিআই না ডিএনআর।
ঘুমে যাবো, ঘুম পাচ্ছে তো
আচ্ছা ঠিক আছে
এখন।
ঠিক আছে।
তাহলে ডিএনআরটা আজকে করছেন
হ্যাঁ
আপনারা?
না আমরা করি নাই আর, না আমরা করি না, আমরা ওইটাই রিপিট করছি আর কি, আপা একবার
দুটো
বললো আমি
করবো
একবার বললাম। ঠিক আছে কোনো সমস্যা নেই।
কালকে কাউন্সিলিং